Hello, everybody, and welcome to the Traumaplicity TM podcast with your host, Dr. Amanda Helman. So great to see all of you every week, or hear you every week, or you hear me. And so we are with the Traumaplicity podcast. And what is that? Well, it's trauma plus simplicity. You think, Amanda, that seems a little interesting. Well, our brain does well with simple. So when we think of trauma plus simplicity, we think of simple steps helping us along our journey to heal different types of trauma, because we know that it's not always easy. Trauma is not always easy to go through, but when we think simply, it helps us. So we have a lot of amazing guests coming up. And even today, I'm so excited to meet with Elizabeth, and I'll be sharing about her in a moment. But when we're on, we ask about the parts of our trauma story, strategies and tools for you along the journey, and words of encouragement to keep you going and knowing that there is hope out there for you. So tonight, our guest is Elizabeth Kipp, and she is a stress management and chronic pain specialist, trauma-trained and yoga-informed addiction recovery coach, ancestral clearing practitioner, yoga and meditation teacher, and international best-selling author of The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. And Elizabeth focuses on helping people realize the power of their inherent healing. She has healed from over 40 years of chronic pain, including anxiety, panic attacks, and 32 years of addiction to prescribed opiate and benzodiazepine medication. She now works to help others achieve the same healing that she had experienced directly from the work she teaches. In addition, Elizabeth offers one-on-one and group sessions in stress and chronic pain management and addiction recovery, ancestral clearing, trauma-informed yoga, and meditation. And we'll certainly have some more on about Elizabeth, and she'll share how you can get in contact with her. So first of all, Elizabeth, wow, just such a background and a plethora of amazing things and tools that you have over the years and with your knowledge. So I'm certainly excited to hear from you. So welcome.
Well, thank you so much, Amanda. I'm so grateful to be here.
Yeah, it's wonderful. So the first question I have for you is, what is part of your trauma story? We know there's a lot, but you're part of your trauma story and the focus that you want to talk about tonight and share with the audience.
I love the question. The part that I wanted to really zero in on was the actual event and then what happens just after it. So because I had read in some trauma, people's trauma specialist books that the brain gets confused and we don't remember well. And I'm going to bring that in and focus in on actually what my experience is that the trauma happens and I don't know what to do with it, right? And it leaves a very deep imprint in terms of the memory in that moment. And then everything that happens in the next, 12, maybe 24, 48 hours is kind of like, I can't really remember that. But I remember the actual incident quite well. So that can be kind of confusion when we go out and do research. It's something I haven't actually seen clarified there. So, and I have a science background and I kind of like precision, so where we can get it. So I just wanted to say that we get a real an imprint, real in the memory there, and then my experience was I don't remember and what's happening there because I'm actually dissociating. It's overwhelming for the system. I don't know how to process it. I don't have anybody to process it with. Which was usually the case for me. And what's beautiful is that the nervous system actually has a plan, right? It actually knows kind of what to do with all of that so we don't blow out all our fuses. It knows how to deal with that. But this is where trauma therapy comes in. This is why we need trauma therapists and we need trauma-informed yoga and etc. We need practices to help us release. We don't behave like regular animals, right? Regular animals, when they have a trauma, they shake it off. We don't do that. We tend to hold on to it. So we have to then bring some practices in that help us release. Yeah.
That's really great. And I'm glad that you talked about the event that happen right after, because as you mentioned, there's a lot of different research, and even now there's a lot more going on with somatic experiences and how our body does, like Bessel van der Kolk says, it keeps a score. There's still those emotions, those things that are hidden, like you're mentioning, and the body wants to release, but there's times where it is, as you mentioned, there's different times of imprint and where we hold on to, we don't even realize. So I love that you brought that up, and it certainly is a part of the trauma and even with the brain research, I love that we're getting so much more to see how things are going. So I love that. And so thank you for bringing that up with your story. And so in terms of any other parts of your story, you can certainly share if you want, but I love that you focus there. But I wanted to see in your journey, because you mentioned you have a lot of background that helped you get to where you are. So what were some strategies, 3 or 5 strategies that really helped you navigate trauma?
Well, one of it was the breath. I had a meditation practice starting back in like 1972 or something. And I knew, now that was, I had trauma before that, but I had trauma after that as well. And the breath was very helpful. A conscious breath, just allowing, because we hold, for me, I hold my breath when I get frightened. Trauma frightens me. And then the whole nervous system I go into freeze mode, and I kind of shut down. So there's a bunch of different ways we can do that, but that's usually mine. And the way I bring myself out of that is to just start breathing long and deep, and that gives I have to do it for 3 to 5 minutes to get the nervous system to actually believe that it's okay. So the breath, long breathing, is really important. Also, I really had to learn to be gentle with myself. I had to actually, accept that I'm having this reaction and that it's okay, because I came in with so much judgment when I was younger about, well, I shouldn't be feeling this way, and something's wrong, and I just and I didn't have anybody really to help me through that. We didn't have trauma therapists back then, and my parents didn't know what to do. People around me, we all just put it under the rug. Everybody just swept it under the rug was what happened for me. But when I got alone, and I literally decompressed myself by just allowing myself to feel, instead of trying to avoid. Remember, I told you I have a reaction, it's an imprint, and then I have this dissociative phase that I go through. Well, part of the healing there is actually stay in the present moment with the breath and allow the experience to unfold. Right? The greatest healer in our body lives, the greatest healer in our life lives in the body. It knows what to do with this stuff, but my mind comes in and will just put a damper on all of it and hinder the process. So that's another piece. Also, I think it's really important that we're not just allowing ourselves to feel the emotion that we're feeling, but the sensation, which is under the emotion, right? And again, I said, be gentle with yourself. I think it's important to get with like a trauma-informed yoga person, or a trauma therapist, or a somatic experiencing person, or a TRE person. That's a trauma attention release trauma method where you shake, right? They teach you how to shake. I think that's helpful. But mostly it's giving myself space and accepting the moment and how I am in it, and not judging it, just allowing it to be. I know, but maybe that sounds kind of like simple or whatever. I'm telling you, it's very powerful.
No, I love that. I love their strategies. And Elizabeth, you're in the right place, because we're looking at simple steps to encourage our audience who think, oh my goodness, where do I start? It's so overwhelming. So I love that you started with breathing, and a lot of times out, I didn't know that when I was a teacher, but like breathing out to help our our parasympathetic, our central nervous system part of it, to go. So you had that great step of learning. And a lot of times people don't always know how to breathe. So you obviously have had training, but really learning how to actually give yourself time to breathe. So I think that's important and practical. And you talked about being kind to yourself, because so many times, especially with traumas, Elizabeth, you brought up a good point that we're not as compassionate to ourselves as we are with others. It is almost like you have to relearn it, as you talked about. And you also said that, of course, you can have different people or therapists or people and mentors, it seems like, or people that can help you, that are trained to help you as you release that trauma, because you don't always know how to. And I love your last part, Elizabeth, that you shared. Yeah, sometimes just sitting with yourself to allow just the space to feel, just that space to heal, and giving that time, because it is true. So many times we don't know how, so we go to things that aren't always as healthy because we just don't know how to cope. And I think you made that great point, as well as our brain and our body aren't always connecting to know that it's okay to do that. So those are certainly really important, and I think simple things to help our audience. So thank you so much for that. And if there's anything else that's coming to mind as I'm just sort of like capturing what you talked about, which I thought was important, you can certainly add to it.
Well, I could sit here for another hour and give you a lecture on the vagus nerve.
Yeah, that's an important
Right.
part. I know.
So that's why the breath works so well. The vagus nerve is the 10th cranial nerve, as you know, that is our social engagement system and our threat assessment system. And when we're in trauma and it's unresolved, it gets dysregulated. So the breath brings in this beautiful, pretty quick, when we do it right, regulation. The trick with the breath, really, for beginners in this space, is make the exhale as long or longer than the inhale.
Mm-hmm.
You can't lose with that. As long as you're breathing as long as deeply as you can, and that exhale is as long or longer than the inhale, it's like a bridge that takes you from this place to this safe place. It's a beautiful bridge. It's like a boat, right? You get on the bridge and it takes you right there. So
thank you. Yeah, that's wonderful. And thank you for explaining that, Elizabeth, to some people in the audience that may not understand. And that's a practical tool to have that exhale be longer than the inhale, and explaining that vagus nerve that does, with regulation is so important. And it is so amazing how the body can respond then, and how we can then start regulating once that is, as we're breathing and as everything's shifting. So I love that. Thank you for sharing that. And then as we continue, so really, Elizabeth, there's people in the audience that may be listening in or watching, depending on where they're at and what you're doing. But certainly there are audience members that maybe be at the beginning. They just had an initial event of trauma, or there might be people on the journey. What are some words of encouragement that you want to give to them?
Well, I said already that the greatest healer in your life lives within. And I would also add to that. So, and why do I say that? Doctors, they're amazing, and this is not a diss on them at all. It's just a statement of fact. Doctors can stitch up a wound and set a bone, but they can't tell the body how to heal. Only the body knows how to do that. So doctors and healthcare professionals, all the healers, they give us steps to optimize conditions for healing, but the body's where the healing is. So I just think it's important people get straight on that. And also, I think it's really important that we believe more in the power of the body to heal than in the process, the trauma process that we're dealing with, or the dis-ease that we're feeling.
Yeah, that's important. Thank you so much for sharing that. And Elizabeth, again, lots of wisdom. I know you've had so many experiences and a lot of great tools that are simple and also practical, and also just from what you've done as well. And so audience certainly can get in touch with her. I will have all of her information. So you can certainly get in touch with her, check out her different social medias. She has all of them listed. So that'll be great for you to do and connect with her, certainly. But Elizabeth, you do have a book, and I'd love for you to share more about your book since you're a best-selling author, and let us know how we can get it.
Great, thank you. The name of the book is The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. And you can get it from me, from my website, an autographed copy, or you can get it on Amazon, either a paperback or Kindle. And what's interesting about chronic pain is we have a trauma experience, and if it goes unresolved, and it creates this tension and this any kind of pain in the body or the mind, just kind of in the mind body spirit system, 15 days out of 30 for 3 months or more, it becomes chronic. That's what chronic pain is. Trauma experience unresolved, sitting in the system. The brain can't tell the difference between a broken bone and a broken heart. So kind of whatever the trauma is, that doesn't matter. It all sends the same signal to the brain. It hurts. And this is the story of kind of what chronic pain is, what the voice of a chronic pain a sufferer sounds like, because normally in chronic pain, we kind of do two things, and neither of them are true. We're either super quiet or we complain all the time. And none of those voices are accurate. They're not the truth. So I thought it would be really helpful. The book is for any healthcare worker, doctors, chronic pain caretakers, nurses, and also chronic pain sufferers, family members as well. It's kind of like the tools, the voice, what the landscape is like for the chronic pain patient, so that the caretakers can understand, and then the tools that I use, the non-pharmaceutical tools I use to heal them. Yeah.
That's great. And I love that the book is for so many different people, so many different stakeholders, or, settings, or, family. And so it's practical to help them understand. And I love that you shared about chronic, just chronic pain and just the timeline and what that looks like, because I think we don't always realize that, just like when we have physical, we go get surgery, but we don't take time for realizing how important our mental health is. It's just like that. We think that it's different. And you brought up a really good point that we really attending to our mental health, and even any of these things are so important, just as much as when we get surgery. So I personally always think that it's important, to allow that time, because they're both very important and equally important. Yeah. So thank you, Elizabeth, for your book. So is there any other parting words that you want to give to the audience?
Well, I would like to say that chronic pain is epidemic in this country. In North America, 25%. This was pre-COVID. 25. The National Institutes of Health estimated 1/4 of the population across all socioeconomic groups, including children, suffer with chronic pain, and the World Health Organization estimated 20% of the human population. So it's an issue. And then COVID hit, and so all bets are off. The numbers are higher now. So it's just bringing some awareness to the problem. And also, you can heal from chronic pain. I sat in front of many doctors for many years that said, you have to live with this. And that was more of a reflection of the limitation of the model they were working on than the body's ability to heal from it.
Yeah.
That's another reason I wrote the book. It's like, well, I suffered with this for 40 years, but it took me a while to find the doctor that really understood the nature of chronic pain. And then I went into his pain management program, and 52 days later, I walked out with no pain after 40 years. Dr. Peter Prescott was the doctor. He wrote the book, Conquer Chronic Pain, an Innovative Mind-Body Approach. He passed away, but he left us this book.
Wow.
And so it's this, my book is really a companion to his book.
Yeah, that's amazing. And thank you for sharing that story of an important thing of you all these years, and then going through and finding some of those keys to help you to say, yeah, 52 days later, that's amazing. And so I really appreciate that. And so for the audience, there is hope for any of you who are listening and have chronic pain, there's always hope. And so Elizabeth is definitely someone you've gone through this journey, you have these tools, and even now more than ever, just so much chronic pain from people. So certainly we're getting near the end of our time, but I certainly enjoyed this, Elizabeth, and probably could talk to you for hours about the brain and everything else. We have a lot in common. And so everyone in the audience, go get their book, and certainly go check out her different areas in our website. And with that said, we are at the end of our Traumaplicity podcast for today. As always, it'll be playing every week, and we'll have guests that are coming to encourage you, share their story, and encourage you to continue, that there's hope and that you matter and your story matters. So thank you all. Thank you, Elizabeth. It was great to talk with you.
Thanks so much, Amanda.
Yeah.